good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Bair Professor of Infectious Diseases here at Northwestern Steinberg School of Medicine, who answers your COVID questions and addresses the latest COVID news every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest headlines through today, the 30th of November. And we invite you to submit your questions to us via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Biskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Hi, good morning.
Now for some updated COVID statistics. We are not seeing any sort of rise in the vaccination rate in the United States, but what we are seeing is a rise in COVID cases. Our now daily average is about 83,000. And yesterday in the States, there were 260,000 new COVID cases with a 3% increase. In Illinois, 61% of the population is fully vaccinated, which has been sort of a consistent number for the last couple of weeks. There's now a 7-day average of 4,661, and this has been a 45% increase over the last 14 days. Many states are seeing a huge increase in cases. What can you tell us after what we're going to see with Thanksgiving and heading into the winter holidays? What are we expecting, Dr. Murphy?
Yeah, well, that's the question, Sophie. We'll see. First of all, that huge number yesterday, over 200,000, really is a lot of the reporting doesn't happen over the holiday. So from Thanksgiving Day to Sunday, many of the states, aren't reporting everything, and then everything gets all kind of straightened out on Monday, that's why the number was so high. But that's what we look at, the 14-day averages. That's really the best. And, the averages are bad. We're 83,000 positive cases per day, still going up. Illinois, 4,600 or so, 45% increase over the last 14 days. This is all going in the wrong direction. We'll see what Thanksgiving did. So, that was Thursday and Friday. People getting together, so somewhere between Wednesday and Saturday, so it takes like about a week to get infected if you're going to get infected. So we would see the next bump. We would see a bump from Thanksgiving, the end of this week into the beginning of the following week, when people finally get diagnosed. So they'll get symptomatic, in 3 to 5 days. So that's, could even be starting today, and you'll see those numbers, if it's going to happen, go up. We'll see how careful people are. I think there's going to be a big variation by state, or even by city, or even by county. There's a lot of counties in the upper Midwest that are not doing well. People just aren't taking this thing seriously enough. And now we have the new variant coming, Omicron, and that could make things even worse. It's not in the United States yet, but I'm sure it's here, or it's coming. So anyway, so that's really the story. We've got to get through this wave, and people, have just got to be careful and just remember, wearing masks works, staying out of crowded indoor places works, and avoiding unvaccinated people if you are vaccinated. If you're unvaccinated, you can meet with anybody, but for the vaccinated people, you want to be safe. Those are the things that you want to do.
Yeah, definitely. And speaking of the new variant, our biggest COVID headline for the day is that the WHO is warning that Omicron poses a very high global risk as it's spreading across various countries in Europe and other places. What can you tell us about what we're going to find with this new variant, where it started, et cetera?
Yeah, we don't know how bad it's going to be. It's definitely outcompeting Delta, at least in South Africa. But there's not enough of it outside of South Africa and some of the Southern African countries to make any real clear statement about what's going on. But everybody is nervous. We're not sure how well the vaccines will hold up. The anecdotal reports from South Africa, which has a pretty good reporting system and a fairly sophisticated healthcare delivery system with 35% of the people vaccinated. They know what they're doing down there, and as other countries in Africa as well. And we'll see what happens. The anecdotal reports are that people who are vaccinated are getting mild disease, maybe even slightly different symptoms. This is all anecdotal, though. I don't put too much into that, but it's definitely not resulting in like massive amounts of people ending up in the hospital that more than expected, or deaths yet. But remember, we're still so early in this Omicron world that it takes a while for people to get sick, and then a while to be in the hospital, and then a while to be in an ICU, and then some people do pass away. So we haven't gone through really that whole cycle with enough people to really make too much sense about it. But everyone is working on this. There are people calling for the vaccine companies, Moderna and Pfizer, AstraZeneca and Johnson & Johnson, to make another vaccine, a version 2.0, to just go ahead and start now. They probably have, but we don't know officially. They've all stated they can do this. It would be a matter of months to do it, and to get a product to market would take a minimum of 3 months, probably more, because it'll have to be tested first. But I think the hope here is that this is like another variant, like Delta, that's easier to transmit, and but you still get some kind of protection from getting severe disease or dying from the infection. So that the best thing now is to get up to date, everybody up to date with the current boosters that are there. And if they change the booster in the next 6 months, well, take that one when it comes up, but don't wait. Remember, boosters are available now for everybody who's taken Moderna or Pfizer 6 months afterwards. Matter of fact, Pfizer has just asked for permission to give 16 and 17-year-olds the booster, because that booster recommendation in the emergency use authorization was for 18 and over. So now they're applying for 16 and 17. So and then we don't know yet about the kids. Well, they haven't even got all the kids haven't been out even 6 months yet. The 5 to 11s. So but everyone that's eligible for a booster should take a booster, and they can mix and match the boosters, and with the Johnson & Johnson one, you only have to wait 2 months to get the booster, because really the whole thing with Johnson & Johnson, they were really hoping, and they had good data to back this up, that one shot would be enough for the whole thing, and that's not true. Okay, 2 shots work better. So, and their shots are 2 months apart. That was the design of that study. So a lot of vaccines are 2 months apart. There's nothing unusual about that. So 2 months after your Johnson & Johnson, you can have another booster, and you can have any vaccine you want. You can have the Johnson & Johnson, or you can have the Moderna or the Pfizer. In the one study that's been done, the antibody response, the spike antibody response to the booster was actually higher if you took the Moderna or the Pfizer one than if you took the Johnson & Johnson one. But just take a booster, and that probably is going to protect you at least from getting seriously ill and dying from Omicron. As that's the best we can just say now, we think. But we'll see what the facts are, and this is all going to roll out over the next couple of weeks.
Right, definitely. And speaking of getting boosters and such, Europe is facing and will potentially face another 700,000 more deaths coming up. But masks could prevent all of this, as the WHO. What can you tell us about social distancing? What's going on in Europe, and what can we see with mask usage in Europe?
Yeah, well, everything has just gone around and back to Europe being the center of the pandemic again. They're doing worse than the United States right now. And for many of the same reasons why we still have a huge problem here. People are tired of the pandemic, but the virus doesn't get tired. It just goes on and on and on and mutates and becomes a new variant. And so it's the same old thing. They have a higher vaccination rate in Europe. They have overall better medical care in general because basically everybody has insurance and everyone can get it. They don't have as big a disparity as we do here, which aggravates things. But regardless, they have a lot of anti-vaccine sentiment there. And in Austria in particular, the cases have just skyrocketed through the roof. And they're in the middle of a lockdown now. They actually have a lockdown again. A lot of people thought that wasn't going to happen again, but the cases were so high. I mean, they're high in all these countries, but Austria, for some reason, is 3 times Germany and the other Northern European countries. It doesn't really make any sense what's going on there, but data are what they are. And so they had to really shut things down. So we may see more of stuff like that. I don't know. It depends how bad it gets in the various countries.
Yeah, definitely. And now for some COVID questions. This individual asks, unencumbered by any medical knowledge, I reason that donating blood 4 weeks after receiving my COVID booster and annual flu would be of an extra benefit to someone. The blood donation center made a note and accepted my donation. Was this a good idea? Does this make any sense? Tell us about blood donation and vaccine.
Yeah. When you donate blood and you have all these antibodies, you do give some antibodies in the plasma part of the blood. They're floating around in there, but it's a very small amount, and it probably is inconsequential. I don't know if anyone remembers, but we were giving like plasma from antibody-rich plasma as a therapy, and it didn't work. And that was after months of this, and it's very expensive to do it, and it's not going to have a clinical effect. But the person's right. You do give some antibodies.
Well, that's wonderful. And now for our second question. I had breast cancer surgery on November 5th, a lymphectomy, and the removal of 4 lymph nodes. Can I get my COVID booster shot now, or would it be best to wait because of the lymph node removal? I've heard reports of the shot causing enlargement of lymph nodes.
Yeah, this is a good question, very common thing. And so what happens is where this whole thing about shots, vaccination or boosters, any kind of injection, it oftentimes causes a temporary swelling of the lymph nodes in the armpit area where you got the shot. And what happened in the original rollout was especially women who had a mammography screening for breast cancer after they had a vaccination. Some of them, the radiologist noticed that some of the lymph nodes were swollen, and they're thinking, well, maybe this is from cancer. And so maybe some people had to get biopsy or repeat the mammogram or something like that. And so you just don't want to confuse the screening for cancer, a component of the mammogram. So this person has already been diagnosed with cancer, has already had lymph nodes resected. So they can have the booster right now. It doesn't really make any difference. There's no contraindication or anything. I would probably, because she's already had surgery on that side, and then she might get some more swelling from the lymph nodes, I would do it on the other side that she had. Instead, don't do it on the same side as the side that she had the lymph nodes removed. But there's no contraindication.
Great. And now for the third question. I received my second Moderna shot 8 months ago. Is it too late to get the booster?
So in general, if you're in a series of vaccines, and this includes COVID, and you're late, that's okay. Matter of fact, in some cases, there's some reports that you might actually even get a better response. But it definitely is not too late. You don't have to start the whole 2-dose cycle again. Just go get your booster. You'll be fine.
Wonderful. And now for our fourth and
It
last,
will work fine. It will work fine.
definitely. And now for our fourth and last question. Why are vaccinated people not tested for COVID like unvaccinated at events, etc.? If vaccinated can get and pass it on to others.
Well, it's all about the numbers. It's all about risk, how much risk you're willing to take. So a fully vaccinated person and a fully vaccinated person who's taken a booster, if they're eligible to take the booster, has actually such a low risk. It's not worth doing the test. Yes, they can get infected. That's true, but the risk is so low, it's not worth doing the test at this particular point. Now, Omicron comes around and changes the game here on how infectious this thing is, and people who are vaccinated, that may change. But for right now, just being in a group of vaccinated people is such low risk, you don't need to test all those people. Now, we've recommended before, like actually even just before Thanksgiving, people gathering for the holidays, if there's some concern about somebody, even if they are vaccinated, you can just do these rapid tests. You can buy them in the pharmacy now, or you can get them at pretty much any medical clinic. There's a whole pile of tests that are approved now. Everyone can get tested. So frequent testing actually may be a way to keep people in groups together more safely. So, that's up to the individual if they want to do that at this point, but that's just another tool that we have to make things safer. But just in general, at these events and stuff, just being vaccinated is good enough. Unvaccinated, no, the rate is so high now in the unvaccinated. If you look at all the statistics for people in the hospital, people who died, people who are getting infected, the unvaccinated are just like way higher than the vaccinated. So they're the ones really at risk. And that includes any child or anyone just ineligible to take the vaccine. So it's just unvaccinated, not just the people that don't want to take it.
Yeah, absolutely. And that's it for our COVID questions for today. Thank you, Dr. Murphy.
Oh, thank you.